Welcome to SourcePoint Care. I'm Dr. Jason Gonzales and I'm the clinical director here. Now we have found there are some conditions that just seem to fall through the cracks of traditional healthcare. Things like headaches, migraines, dizziness, anxiety, some digestive issues, some chronic neck and back pain problems, balance problems, vertigo, things of that nature. Now the reason some of those fall through the cracks is that most of our healthcare system is designed to manage symptoms, not dig down and find the root cause of the problem. And with recurring and chronic issues like those, there's often an underlying neurological issue that's behind them and driving those recurring symptoms, which is why treating symptoms never really lasts. They always come back. The very first thing we test for at SourcePoint Care is that underlying neurological problem. And we have found in many cases, it's related to what's happening in the upper neck. So we are chiropractors. A lot of times people have already tried chiropractic care before they come in to see us and they're wondering, well, what are you guys going to do that's different? I've already had adjustments before. Well, the difference is that we specialize in the upper neck. And even though we specialize in the upper neck, that's where we make our adjustments at atlas or axis, or sometimes called C1 or C2. That area of the body, the upper neck, is influential for the entire system of your body. We call it the neurological fuse box for the body. It controls things like your balance, your posture, your blood pressure, your cardiac function, your digestion, all of it. And so by specializing in the upper neck, it doesn't mean we just help patients that have upper neck pain. The adjustments we make at atlas and axis, or C1 and C2, help the entire body. And what people like about this type of care is that they don't have to get adjusted every time they come. It seems like a lot of chiropractic experiences lead to an adjustment on every visit, and usually in multiple places on every visit. Well, the way to get somebody from chronically unwell to well doesn't really mean we have to adjust them a lot. It just means we have to know where to adjust them, when to adjust them, and importantly, when to stop, which is where that infrared thermography test that we do is so important. It helps us measure the function of the nervous system so we know when the treatment's working and when we need to back off and let the body heal on its own. So if you're struggling with some chronic and recurring symptom that isn't really getting any relief or any lasting improvement through traditional healthcare methods, this may be the answer you're looking for. The first thing we'll do is test your nervous system. If we find there to be a problem related to the upper neck, then we'll move forward with the rest of the exam process. The biomechanical x-rays, the hands-on orthopedic and neurological testing, and kind of round out the clinical picture. The goal is to get you well, not to get you adjusted. So if we can help you, we'll let you know. And if we don't think that we can, we'll be honest about that as well. We'll do our very best to refer you to another doctor or another type of healthcare clinic that does something different, and hopefully you'll get the answer you need there as well. So if you have any questions, don't hesitate to reach out and get in touch with us. We have a contact page. If you want to come in for that free neurological testing that we do, there's also a page for that. Just give us your first name, your phone number. Tell us a little bit about what's going on with you, and we'll reach out to you and get you started. All right, take care.